So we're going to talk about ulnar neuropathy today. My name is Dr. Mark Rutherford. I am a chiropractor, 36 years. I am also a certified functional medicine practitioner, and this is my colleague,
Dr. Reno Gates. I'm a chiropractor as well as a board-certified chiropractic neurologist.
And we have married those two disciplines, functional medicine and do you want me to? It's referred to as functional neurology.
Referred to as functional neurology. I made
functional. We've only been working together for 5 years, and I have to ask him what it's referred to. But we try to be very specific, based on making sure that we're not saying things that our board wouldn't want us to say. So, and between those two, we've come up with a very consistent model for chronic pain, and so we work with a lot of chronic pain. And the practice has evolved very interestingly to the point where peripheral neuropathy ends up being a large part of our practice. It's probably 30–40% of our practice. And so we have a pretty good idea what's going on with peripheral neuropathy, we think. Dr. Gates has managed to create some novel approaches to peripheral neuropathy. So what we're doing in these snippets that we're doing on these different neuropathy conditions is just basically sharing with you what we know, what we found out, whether it was diagnostically, therapeutically, what works, what doesn't work. We are going to talk about ulnar neuropathy today. We are finishing up a book. We're collaborating on a book. We are researching it and editing it, and it should be out sometime this year on peripheral neuropathy. And there's about 80 different types of peripheral neuropathy, and we're going through each one of them, and so that people who are wondering about, where do I fit in this, and what's the treatment, and what works and what doesn't work. Hopefully we can answer that for you. So we're going to talk about ulnar neuropathy, which, again, we put in the category of something called a pseudo neuropathy. And we'll explain that because Dr. Gates will explain this relative to what neuropathy is and what pseudo neuropathies are. But I think that's a salient point relative to maybe clearing your mind up on whether you have neuropathy or what it means or how it can be treated and so on and so forth. So we're going to talk about the funny bone nerve. That's what we're going to talk about. The other nerve is the funny bone nerve. Okay?
And you are funny. You never cease to crack me up. I love it.
Well, that's what people think. It's the funny bone nerve.
Oh yeah, you are great at getting to that level, and I'm horrible at it. It just takes me like
what level
8 translations.
Is that?
The level of what most people associate it with.
Yeah, so they know right away.
Exactly. I love it.
Hey, I'm from the Berg in Trenton, New Jersey. Okay, we're here in Reno, Nevada, but that's how I grew up. So we will converse on every level that we need to converse between the two of us to be able to talk to whatever audience is watching. I can assure you that.
So very true. So right to it.
So to the intellects.
No, and I try and bring it.
Joke.
Yeah.
This is good. So okay, so ulnar neuropathy.
So yeah, as you discussed, we treat a lot of peripheral neuropathy. Peripheral neuropathy, for most of you out there, means when people get numbness and tingling in both feet, progresses up to the knees, and then can go to the hands.
And the key is both.
Yes, and a lot of patients come in, let's say, with numbness and tingling in their feet, and then one hand is numb. Well, we differentially diagnose to see, is it numbness in the hand due to the peripheral neuropathy, or is there something else going on? I explain this horribly, but just to be specific, peripheral neuropathy really refers to when there are many nerves involved. The technical term for it is polyneuropathy. We won't get into it any more than that, but just know that
polyneuropathy, many nerves,
multiple nerves.
Many neuropathy nerves.
In the lay lexicon and even medical literature, they'll refer to that as peripheral neuropathy. Now, you need to know that an ulnar neuropathy is technically a peripheral neuropathy, but it's not polyneuropathy. Was that a better explanation? Did that kind of get?
No, but yes, it is a better explanation than our last snippet.
Yes.
But in the end, the reason that we're defining that is a lot of people who come in here, we do these consults, and they'll come in with this one-sided thing. Going, I was told I have peripheral neuropathy. Peripheral neuropathy, classic peripheral neuropathy, is going to be both sides, both feet,
yes,
both hands, and possibly multiple symptoms: burning, tingling, numbness, cramping, sharp shooting pain, something like that. We call the funny bone nerve, we call the ulnar neuropathy a pseudo neuropathy because they're basically classifying it because peripheral neuropathy can mean you're having pain in the peripheral nervous system, which basically means your feet or your hands. So to have it in one leg or one hand, technically it's not peripheral neuropathy. frankly. So why don't we go on with that?
Perfect. So basically, with an ulnar neuropathy, there can be a variety of causes. Lots of times it happens in people who are in wheelchairs or who are bedbound. You know, you're in the hospital because you break your leg, you're there for a couple of weeks, and you're sitting there on your arms like I am, and the nerve runs right through that funny bone. It's called the cubital tunnel, basically, and it's part of the two bones that make up your forearm and your humerus. Anyways, as the nerve runs through there, it can get entrapped and get compressed very easily. And sometimes they'll even refer to it as a tardy ulnar nerve palsy, where when somebody has been doing that for a long period of time, eventually the nerve just kind of breaks down and wears down due to being compressed and stretched. Also, for those cyclists out there, cycling is a growing sport, especially because it's a lifelong sport. You can be 70 years old and doing it. The ulnar nerve runs through the tunnel of Guillain, as it's termed, and if people are putting a lot of pressure on their handlebars,
which is separate from the carpal tunnel.
Yes,
there's two tunnels here. Okay, so one's carpal tunnel. Most people seem to be semi-familiar with that. Most people are not familiar with what Dr. Gates just said, which is a separate tunnel.
Exactly,
which hits different.
Good pickup there. And so basically, the nerve that goes through there is the ulnar nerve again. And the ulnar nerve is different from the carpal tunnel nerve, whereas the carpal tunnel nerve mainly innervates these three fingers, whereas the ulnar nerve innervates mainly these guys. There are a few nuances we won't get into, but in essence, patients who have ulnar neuropathies, lots of times they can get what's termed a claw hand, because they can't bring these digits, these fourth and fifth digits, your pinky finger, they can't bring them in because the muscles are so weak. And muscle weakness is one of the primary things that diagnoses an ulnar neuropathy of these specific fingers, as well as there's something called a Froment's test. If you think you have an ulnar neuropathy, try and take a piece of paper, not like this, but like this, where you grab it with your thumb flat and have your friend try and rip it out, and if you can't keep it there, that likely means that you have an ulnar neuropathy. And there are many other things that we can go into, fractures in all these locations, and rheumatoid arthritis can result in a ulnar neuropathy because people get inflammation at their elbows or their wrists. But in essence, that is what causes ulnar neuropathy, and that's what it entails. And we have a series of videos up on our peripheral neuropathy group.com website talking about all forms of neuropathy. What were you going to say?
They're probably wondering what's the solution.
So the solution is...
So there's a variety of causes.
There are a variety of causes, and if there's a surgical solution, they will do that. You know, if you have an ulnar neuropathy because you've been sitting in a bed for 6 weeks and now you're going to be out of the bed, lots of times they'll just see if you heal.
Yeah, a lot of times, I mean, we were considered alternative practitioners, although I don't consider us alternative. And we do work in an integrated model. We have some medical doctors that we work with, some osteopaths that we work with on a variety of different cases. But a lot of people come in here and they're just like, how do I do this without getting surgery? Well, sometimes you don't.
Right.
Sometimes you have to address it. If it's rheumatoid arthritis, we can't even get into that, but there are alternative ways of dealing with rheumatoid arthritis that can be very effective. If you have a big rheumatoid arthritis and you have corruption in there, bone spurring, corrosion, all that kind of stuff, you know, you may need to have that handled. So you need to find out what it is, and it's a broken bone. Obviously, you fix the broken bone and things of that nature. So. But
so commonly, this is a great question. So commonly, what we do with peripheral neuropathies is that if we can address the underlying cause, so if you're compressing your ulnar nerve and we can stop doing that, that's a good first start. And then if we can go back and electrically stimulate that nerve so it functions better at a certain metabolic rate. You don't want to overstimulate the nerve, but if you stimulate it back while doing some rehab exercises, we've seen some good results with peripheral neuropathy. So,
yeah, so it's really based on the good exam, good history, find out which one of these things it is, good exam, find out some of them, the point being some of them can respond to non-surgical means, some of them can respond to surgical means. So you kind of have to do your research a little bit. You need to get somewhere, and you need to get a good diagnosis, a good exam. You need to get a good exam, good diagnosis, good workup, definitive diagnosis, and then you can start making decisions on which way that you want to go or need to go.
All right, and if you have any more questions, go to powerhealthtalk.com, send us your questions there. You can go to our Facebook page, Power Health, and we'll talk to you next time.